What do you do if you are on Ozempic or GLP-1 agonists, drugs like Ozempic, for the purpose of weight loss or diabetes, and you're planning to go through an egg retrieval? This is something I discuss every day with my patients. It's a question that came up a lot on the heels of my more recent post on Ozempic Babies. I'm Dr. Lucky Seekon, a double board certified OBGYN and REI, here to answer the question of how to approach taking Ozempic if you're planning to do an egg retrieval for egg freezing or IVF. Anytime someone's on medication and they're gearing up for an egg retrieval cycle, it's a really natural question to ask. Could this medication impact my ability to respond to treatment? Could it impact the health of my eggs? Now, based on the mechanism of action of GLP-1 agonists, it doesn't make sense that they would have a direct impact on eggs or egg quality or response to treatment. But there is a concern when it comes to the anesthesia that's required during the egg retrieval process. In June 2023, the American Society of Anesthesiologists put out a consensus guideline stating that there was a real concern about the fact that these drugs can slow gastric emptying, and therefore, even if a patient adheres to the normal rules of fasting after midnight or fasting, for 8 to 12 hours prior to their procedure, they could be at an inherent risk of regurgitating undigested food, and that could cause aspiration, which can have deadly consequences. As a result, they put these guidelines together that essentially give very clear guidance on when you should stop your medications like Ozempic prior to undergoing the surgery. So you should always talk to your doctor to understand your clinic's guidance. In general, what I tell my patients is to not take any further doses once they start the injectable medications to stimulate their ovaries, because that process is roughly 2 weeks long. And so if they just don't take any further doses, they should be fine for retrieval. A lot of times when I share this with patients, they will follow up with the, "Are you sure? I mean, I can stop it for 2 months in advance." And I always explain to them that guideline of stopping 2 months in advance of pregnancy has nothing to do with the impact on your reproductive organs or your eggs. It's about not having human safety data and wanting to make sure that you have an adequate washout period so that there isn't a chance of in utero exposure to something that has been shown in animal studies to potentially lead to fetal growth restriction and certain birth defects. When it comes to fertility and gearing up for IVF or an egg retrieval, there is evidence that having an elevated BMI, especially above 40, can be associated with a poorer response to treatment and even lower live birth rates. In this study published in 2020, first authored by one of my colleagues at RMA of New York, Dr. Romansky, they actually found a significantly lower live birth rate in women with a higher BMI than those with a normal weight. And they actually found that this was because of higher miscarriage rates in the higher BMI group. This was a retrospective study, so we don't understand the exact relationship. Was this because of the impact of an elevated BMI on egg quality or endometrial receptivity, or both? Given the accumulating data linking obesity with adverse fertility and pregnancy outcomes, a lot of patients in the lead up to a cycle or preconception in general are going to make a concerted effort to lose the weight, whether that's through lifestyle changes alone or if they need the help of pharmacologic agents like Ozempic or even measures like bariatric surgery. Losing weight is hard and it can take time, and we have to balance the potential benefits of weight loss and treating obesity with the amount of time spent and what that could mean for egg quantity and quality, which is so important, especially if you're going to go through the IVF process. So yes, a lot of my patients, especially patients who have struggled with their metabolism, like those with PCOS, have used medications like this to effectively lose weight over a shorter period of time. And this really sets them up for success, for hopefully a more successful cycle outcome and a healthier pregnancy. So it's definitely something that we will strategize and say, okay, it makes sense maybe to be on these drugs for a few months in the lead up to a retrieval cycle. Then obviously you're going to stop the medications prior to the actual retrieval, and then you're going to stay off of them because you want to be off of them for ideally at least 2 months prior to the embryo transfer. So that's really how we approach it strategically.